COVID-19 cases, hospitalizations, and deaths have been soaring with the advent of cold weather. But there are two big actions that would be very helpful in responding to this terrible crisis. Hello, I'm Steve Forbes, and this is What's Ahead, where you get the insights you need to better navigate these turbulent times. First, with vaccines now a reality, priority should be given to the people most likely to die from the disease. That is, start with the elderly and work down from there. Only 17% of Americans are above the age of 64, yet this group accounts for 80% of pandemic fatalities. Those aged 85 and above make up only 2% of the population, but about 33% of the COVID deaths. That cohort should be vaccinated first. Obviously, shots should also go initially to nursing home caregivers and others treating pandemic patients. But the focus should be on the most vulnerable. After the elderly, priority should be given to people with underlying conditions. Disgracefully, the FDA made the deadly decision to dawdle with its final approval of the Pfizer vaccine for public relations and political reasons. This has cost lives. The message going forward should be stark: no more politics, and move with all deliberate speed. By contrast, the United Kingdom has already begun a national launch of inoculations with the Pfizer version. Several million will have been administered by year's end. Unfortunately, in this imperfect world, some people will suffer what could be serious side effects. But overall, these vaccines, when administered, will save countless lives here and around the world. The second big thing to lessen the damage of this surge is for politicians to stop imposing harmful, unscientific dictates in response. The most conspicuous example is barring or restricting kids from physically attending school. Politicians are following orders from teachers' unions, intent on shaking them down for more money. European schools are open, and so are those in Japan and elsewhere in the world, with no harm done. Also, there have been no consequential differences, amazingly, between places that aggressively locked down and those that didn't. Nonetheless, Illinois, Michigan, California, and other places are locking down in bulldozer fashion, gratuitously destroying small businesses while harming the financial and mental health of millions of people. The worst is California, whose idiocies know no bounds, such as outlawing outdoor dining when the evidence that eating in the open air doesn't propagate COVID. Not far behind is New York's ill-tempered, autocratic Governor Andrew Cuomo, who has taken to dictating what kinds of foods eateries and bars must serve. COVID-19 is ghastly enough without the harm being inflicted by power-hungry politicians and politics-playing government health agencies. I'm Steve Forbes. Thank you for listening. Do send in your comments and suggestions, and I look forward to being with you soon again.